Hey, Lisa.
Good morning, everyone. We've got just a couple more minutes before we get started. So thank you all for signing in early. And if you will, just hang on momentarily. All right, I have got top of the hour. So thank you all again for joining this morning for our 2026 HWCF Grant Program webinar. It's kind of hard to believe this has been next year will be our 10th year having this grant available for our members. So we're very grateful to our board of directors for allowing us to continue this program. I think it's been very successful for all of our members who have received any of the grants throughout the years. And we've had some that have received grants multiple times. They apply every year. And their applications, I will tell you, all the applications just get better and better with time. The projects have all been amazing. And I just want to welcome you again and say, please forgive me for my voice. This is actually the first week I've had any voice at all in 6 weeks. I don't know what happened. Something, my husband said it was a Christmas miracle, but I don't believe that's true. So I do want to welcome Christy Kelly. You may see her on the screen as well. She is with Huntsville Hospital. And Christy, if you want to just introduce yourself momentarily.
Yes, I'm Christy Kelly. I am with Huntsville Hospital Foundation, which supports the main campus of Huntsville Hospital Women and Children, and Madison Hospital in North Alabama. We are part of a larger hospital system encompassing many, many counties all over North Alabama, and many of our affiliate hospitals are also members of HWCF. We're just really thankful for this organization and what they do to inspire workplace safety. And this grant has been tremendously helpful, not only at our main hospital, but at our affiliate hospitals too.
All right. If you could not hear either myself or Christy, please type it in our questions box. And if you heard everything fine, that's great as well. But just know that that question box is out there for you all. If you have questions, interrupt us. I'll be happy to address those as we go along. And we are so, like I said, grateful that Christy could join us and provide some of her expertise on grant writing and grant applications. Um, I just asked her to join. I could have asked so many others because we have winners that have been continually winning year after year that are not grant writers. But I just thought maybe she would have a few tips and just some ideas and thoughts to share with you all as a grant writer that I would not be able to share with you. So hopefully that will be helpful for you all. So getting us started, and I did get a message that there was maybe some confusion because some people had a brochure that said 11 to 12, and my apologies about that. We are recording this, so if anybody joins at a later time or would like to rewatch or whatever, it will be available on our Inspirian.net website, and that way you can access it anytime. Also, another reminder, in the materials where you see the little paper clip, I do have a copy of the application itself, and I do have a copy of the scoring tool. I have a copy of our webinars for the year. Those have already been planned out, so you can sign up for them all the way through October. And I have a list of our updated classes. So if there's a class that you'd like that we don't have scheduled for our webinar, you can just reach out to me and let me know. All right. So our mission and vision, of course, are listed here. We really try to be a remarkable partner for you all and be there for any kind of risk in currently, in the past, or in the future. So we think that this grant program follows along with our mission and vision very closely, as well as our values that you see listed here. Um, we couldn't do what we do without you all, and we hope that you feel the same about us, that we're there for you when you need us. So you can see our core values, and I think that we try to live up to each of those for every one of our partners out there. The purpose of this goal of this grant program is really to align with our mission, our vision, and our values. We want to work together with your unique ideas. You all know what your facility needs way better than I would know just stepping in for a few minutes and seeing a small picture. You all get to see the big picture. Your staff know what your needs are to keep them safe. So the program objective is really to encourage and support member efforts in developing innovative, safety sensitive projects while mitigating the cost of developing, participating in, or enhancing a risk reduction strategy, program, or process related to employee safety. So please keep in mind that this grant is specific to employee safety. The more that you put about your employees, the risks, and what's going on, even in your facility, your community, your state, or within the United States in general, the better off your application is going to be. So be as specific as you can. If you know that your facility has had X number of assaults or near assaults, near misses, put that information in your grant because it really speaks to our grant scores. It gives them a picture. And as long as you provide an application that they can paint a picture with, it means a lot to them and it helps your scores overall. So the goals here, this is all listed on the grant itself. That's where I got all of this PowerPoint from, but it just saves us from having to read it on the grant application. But it's to provide a tangible incentive to decrease the number and or severity of workers' compensation claims while also improving employee safety. Furthering the positive impact, the ideas that are generated in your grant submissions may be shared with all of our other members so that they could initiate the same type of program within their facility if it applies to them. Now, not every grant application is going to be specific to every facility out here, right? We have different types of facilities that we insure, and sometimes it may be specific to a psych unit or a psych facility, and sometimes it may be open to any facility. We'll kind of go over some of the examples here at the end. But the overview of the program itself, we are going to again award up to $100,000 this year in grant money, which means there's a total of up to $20,000 per facility that applies until we hit that $100,000 mark. So for instance, if we have our top 5 grant scores all requested $20,000 in money, then we will only have 5 winners. But if we have our top 3 request $20,000 and then several others request something like $10,000, $15,000, we may actually have more than 5 winners. It just depends on the request and the need. Facilities are only allowed to apply for 1 grant per year per policy. So if you have a healthcare system like Huntsville does, or like other facilities that we insure do, then you can reach out to us and ask us, hey, can we apply for X, Y, and Z facility, or can we only apply for 1 grant? Now, keep in mind that if you apply for an entire healthcare system with only 1 grant, you can do that, right? If it's something that you can include to be implemented at every one of the facilities, you're certainly welcome to do that. But it's per policy. So just keep that in mind. Facilities must include a detailed budget for what the money is going to be utilized for. I have to know that it's not just going to be, thrown away. None of us have enough money to throw away, so I'm not too worried about it. But it does have to be detailed so that the scores can understand and so that our board of directors can understand. You are required also as a winner of the grant to submit progress reports to me throughout the year. The first one will be done at 3 months after the start of the project. Now, when you win the project, if you're a winner, that will be announced in May. The project start date is usually around July. So you still have time. And then that means 3 months after July is when your first report date is due. And that first report date is just simply, where are you at? Have you ordered equipment if it was equipment that you were requesting? Have you trained any staff? Those kind of things. Just kind of keep me up to date. The 6-month report after initiation of your program is where you will try to give me back some data. At that point, if you've gotten any injuries related to a piece of equipment or your implementation of your program, I'd like you to include that sort of stuff. If you're doing surveys with your staff for how safe they feel after implementing something, then you may have that available at that point, or you may not. That may be available at the year mark. But your last report is due 1 year later, which is generally around July, and this time it would be July 2027. We may reach out to you periodically throughout the years following a grant win, because sometimes I'll have a hospital or a facility call me and say, hey, we remember somebody won a grant using this piece of equipment, and we'd like to get more information of where they're at now. So I might reach out 2 or 3 years from now and say, hey, got somebody interested in what you won with our grant on this day. Are you still implementing those measures, or that piece of equipment. How's it going for y'all? Because guess what? Sometimes these programs work very, very well. And sometimes they learn it wasn't a good fit. And that's okay. It's taking a step forward and trying, right? So just keep that in mind. 50% of the grant funds, if you're a winner, will be initiated or provided to you in May when we make the announcement of the winners. And we always usually pick May because that's our board of directors meeting. And they love to hear who the winners are as being the first ones to hear it. And I can't blame them. So we usually implement 50%. So if you applied for $20,000, you would get $10,000 in May, and then you would get the other $10,000 after you submit your mid-year report, which is going to be January of 2027. So as long as you keep me up to date with the reports, and things may change. Chrissy has actually had this happen with their facility with a grant win, where they intended to implement on this date and order a piece of equipment. But we all know that sometimes things are backlogged, right? And it may take a while for you to get that piece of equipment, not when you expected it. All I ask is that you just keep me up to date so that I can keep our board up to date, and then we'll follow up later on. It's very simple. We are very laid back. We just really want to know where you are with it. And I like to pop in and kind of check on things every once in a while just to see how the implementation is working and how your staff appreciate it. So to be qualified to apply for the grants, pretty simple. You have to be a current member with our HWCF. You have to be current with your financial obligations with HWCF. Typically, that's not an issue, but if you're concerned about it, reach out to me and I can double check with our accounting department and make sure. Because if you're a super large hospital system, you might have like 100 different times that you're paying us throughout the year or more. And so one person is difficult to keep that up with that. So just ask me and I'm happy to provide it. The grants this year may be, they have to be submitted by March 20th at midnight. I believe that's a Friday, if I'm not mistaken. Look real quick. I try to make it that way so that you don't spend your whole weekend there working on it. Yes, it's a Friday. So as long as I get it by midnight on Friday night, Saturday morning, you're considered good. If on Friday you're working on it and something happens at your facility and you don't get to submit it to me, reach out to me. Let me know. I got a little bit of wiggle room, but not much. And I can't do it for everybody. So please try to work on your grant as soon as possible. Don't wait till the last minute, because I have had people that really intended on applying and then something happened and they never were able to apply that entire year just because they waited until kind of the last minute. The project must be specific to risk reduction initiatives with the goal of reducing or minimizing risk related to your workplace injuries by reducing occurrences and or improving employee safety. Your projects must have desired outcomes that are identifiable and measurable. This is an area where a lot of our applicants struggle. We'll get the grants in, but their goals are not really measurable. So be sure that they are. And if you want to reach out to me, I'm happy to help you talk through that on how to make them measurable. Sometimes it is by adding a survey, doing a survey before you get this piece of equipment or whatever your intentions are for the program, and then doing a survey following it with your employees. Do they feel safer since implementation? If you have injuries related to why you're applying for this program, include that and put that as part of your goal. Maybe your goal is to have 0 injuries by that year mark, but maybe your first goal is to have a reduction of 35% if you have several injuries. Make them realistic, right? And make them fit your needs. The project should be adaptable to others within your same type concept. So if it's specific to a psychiatric facility, it should be adaptable to some of our other psychiatric facilities. You should have a letter of support by your CEO, and we put that in the application. All you really have to do is get that signature and date. But I will say that a lot of our facilities get a typed out letter from their CEO and their managers that are going to be impacted by this purchase. Um, and they use their own letterhead and all that. You're certainly welcome to do it either way or both. But I do ask you to have that one letter signed that's in the application, just so it looks like it's complete to our scores. The detailed budget I already mentioned, you've got to have a project coordinator, somebody I can reach out to. Like I reach out to Christy at Huntsville or any of our other winners. I have somebody I reach out to say, hey, it's almost time for your 3-month report, just checking in with you. Or in case your project gets delayed, then I have that person to go to. And sometimes that person will change. We all have turnover. So I have worked with facilities where somebody like Christy was my contact, and then all of a sudden Christy's not there anymore, or Christy's taken on a different role. Then just let me know who my new contact is, and I will keep them up to date with what all's going on. And then, of course, you have to commit to reporting those progress reports as scheduled. You also need to include a letter of support from your senior leadership with any collaborating department. I mentioned that earlier, and it's just so very important to show that, if a nursing supervisor is going to be impacted by this, you have somebody within that division that writes a support letter. It doesn't have to be a long thing. It could just be a little paragraph to say why you support it. You can have one person type up all these different letters and then just have signatures put on them per the people. It's really good either way. You just want it as personal as you can get it. There are very few exclusions that I want to mention. The first one is you cannot use the money to make a new position or to hire a new staff member. We just can't do that for anybody. Reimbursement for an existing purchase. If you already implemented something 2 years ago and now you want us to pay for it, right now this grant doesn't support that. This is for our future purchases. Now, you may have already gotten quotes and all that kind of stuff, but we prefer that you are moving forward with this from this application. If you purchased it at Christmas, let's say, in hopes that you were going to get to apply for this grant, reach out to me. Okay. We can work through some things, but in general, this is for our moving forward. If you're not a current member with us or you're not current financially with us, we cannot accept your application. Otherwise, the sky is the limit, right? You can really think of anything that could impact your employees to apply for. The process itself, you have a problem statement that clearly identifies a workplace initiative targeted at reducing occurrences and or improving employee safety. This needs to be very clear to our scorers. Put in there exactly what you want and why. Okay. This is the problem we're having. This is how we want to fix it. Your initiative represents a significant method of reducing workplace accidents, incidents, or injuries. Your problem and need statement is supported with baseline data or statistics, or you justify the need to address the problem. So if you don't have any employee injuries, let's say you're purchasing a bariatric stretcher. We had multiple applications for that last year, and we had a couple winners for it. If you're purchasing a bariatric stretcher and you've not had any employee injuries with your regular stretchers, why is it important for you to get this bariatric stretcher for your employees now? Think about it. Think about, are your patients that you generally see weighing more and more every year? Are your staff aging? What's going on across the state with obesity? What's going on across the nation with obesity? Those kind of things are what you should research and provide with your data. And then, of course, the goal of the project reflects the overall end result of your project. Your objectives need to be realistic and appropriate for you. They are measurable. That's very important. Your workplace hazard must be impacted by the project that's addressed and appropriate. Your activities and methods to achieve your objectives are reasonable to accomplish the goals. And necessary resources such as materials and personnel to carry out this project have been identified. A lot of times people will forget education, maintenance, biomed. So if you're applying for a bariatric stretcher, remember that it's got to go through biomed. Remember that you've got to have your staff educated on the use of it. Is it going to be implemented into their annual competencies? Is it going to be taught on orientation? Those kind of things are really important to consider putting in your application and measuring as we go forward. Do you report on this, or will you report on this at your daily safety huddles, at your monthly quality meetings, those kind of things? You just need to look at the overall picture. And like I said, reach out to me if you have questions and say, hey, did I forget anybody? Can you help me with the overall picture? And I will do my best to help you. I don't score these. I have nothing to do with the scoring, actually, except for multiplication once I get the scores back. So I am at liberty to help you all with your application itself. It doesn't mean you're going to win. Trust me, I've helped people and they didn't win. It is all in the scorer's hands. But at least sometimes having an outside person look at it can be helpful. Your desired project outcomes are described and represent an improvement in your workplace safety, which will positively impact liability exposure that we are responsible for. All collaborating departments and leaders are identified. Your project timeline is provided and represents a feasible progress toward completion as you know it at the moment, because we all know things can change. And you've got an appropriate team identified to accomplish this project. The method for evaluation of the project's effectiveness is described. Evidence of data related to the project for your short-term and long-term goals to improve the processes and outcomes are demonstrated. The standard to determine success is stated, and leadership support is described in this project. So again, the proposals must be submitted by March 20th at 11:59 p.m., right? Grant proposals will be reviewed for eligibility, which I'll show you the eligibility form in a moment. That what I do. I just go through and mark yes or no to say you are eligible for me to move this forward for scoring. All grants will be redacted of any identifying information. Now, our scorers live in Texas, Mississippi, and Louisiana. They don't know our facilities, but just in case, so that it is across the board equal, I remove any identifying information, such as names, addresses, phone numbers, just things like that. You can mention yourself as much as you want. I want you to talk about your community, your city, those kind of things, but I'll just redact that out because it's not important to them, but it is important to us and to you. Grants meeting all requirements will be forwarded to those independent scorers, and then scorers will then return them to us so that we can announce our winners. So the winning grants, any organization that wins a grant will agree to the conditions applied in the grant. So that would be that you will complete those reports to me. You'll help me through the situation. If we have somebody ask about what you applied for, you'll talk me through what was the good, what was the bad, what was the pretty, what was the ugly, so I can share it. You'll share your project information and outcomes with other fund members, and you'll share pictures of your project. We really love to get pictures of your staff with the new wheelchairs, with the new stretchers, with whatever your project may be, so that we can share them on our website and promote your facility. We want to work in conjunction with you all to support your facility in your communities and make you stronger in your community. So here's just some examples of previous winners. The red wax floor system was one that a lot of people were interested in. And the winner of that project I reached out to last year, and they are no longer utilizing the concept simply because it was too expensive to continue to order the wax system and everything that was needed. So that was a good one for the purpose at the moment, but it wasn't a long-lasting winner for them or for us. Badge swipe door entrances. A lot of these have to do with security because workplace violence is on everybody's mind. So think about all your entrances, and are they open to the public? And is anybody watching the public walk in those areas? And if not, then that may be something you consider. Patient lift systems. We get requests for Hoyer lifts or different types of, we've even gotten types of requests for fall lifts. So now when a patient falls, they have a lift specifically to help that patient back up that doesn't injure your staff. Meal carts. If you still have the old, really heavy, squeaky meal carts, they have some brand new ones that are much lighter and easier on your staff. Security vests, body cameras, metal detectors, panic buttons, and lanyards. Those have been winners over all the years that we have supplied this grant, because everyone knows how dangerous our work is these days. Transfer boards, patient transfer chairs, train the trainer restraint-free equipment. That was at one of our mental health facilities. They want to train the trainer. We paid to send that person off to be trained and certified, who came back and then trained and certified more of their staff. Vehicle GPS, dual facing cameras, and panic alarms. This was another mental health facility that transfers children all the way across the state every single day. And they wanted to make sure that their drivers were doing the right things. So they applied for this and won. And it is an amazing system that keeps up with their drivers on a regular basis. In addition to that, we teach them defensive driving upon hire annually. Motorized stretchers. So your staff are not having to push some of those heavy stretchers or the patients that are on them. Emergency mass notification systems. Think about what if something happened as an emergency at your facility and how you communicate to every one of your staff members. Is it a quick, simple thing, or is it kind of detailed where people have got phone numbers they're trying to contact? Some of these are automated and they go directly from your facility to cell phones that are assigned to them, emails, a banner across the actual computers that are being utilized in your facility. Bullseye Extinguisher System is a fire extinguisher training program that monitors your staff's timeliness on responding to a potential fire, including actually utilizing a fire extinguisher to put it out for training purposes. Custom psychiatric doors at nurses' stations, bulletproof glass at registration areas. All of those have been won on more than one occasion. So think about, what are some of your employees' claims? Can you mitigate any of those claims with a specific project with the grant? What do you or your staff see as a potential employee claim issue? And can you mitigate it with this process? Ask your staff, talk to them. They know what they need or what they want. And even though a lot of us have wants, the budget can be a problem. So think about utilizing us. $20,000 can go a good ways if you want it to. And you may have to compensate some of the monies on your end, but that only shows your commitment further, right? So here's our critical dates page. I put this in here just so, it's one page that you could keep out of all this if you are a winner, because it says when the deadline for submission is, when we're going to make the announcement, when that first money is going to be paid, and when all the progress reports need to be submitted throughout the year. So I'm going to save my voice for just a moment. I'm going to stop sharing, or actually let me just pull up something else. Give me 1 second. There we go. Let me pull up this next. And I'm going to allow Christy to talk with you all about this. And then I will come back and try to help close any gaps between the actual application and the scoring tool so that you know exactly how to match those two up when you're doing your application. So Christy, I'm going to turn it over to you.
Thank you. I definitely want to just reiterate a couple of things and highlight a couple of things that you just said, Lisa. First of all, Lisa is an amazing resource. This organization really believes in their mission for employee safety, and Lisa has such a high passion for it and is such an incredible resource as a grant writer. Um, I don't get those resources very often where I can send her a proposal before it's due, have her eyes on it, give me constructive feedback that is actually really, really helpful. She's really made me a better grant writer over the years by coming alongside and really giving good constructive feedback. So that point that she said about, sometimes you have to wait till the last minute, things are out of your control. But if you can get this done early and send it to her, she will actually look at your proposal. I'm sorry, Lisa, I'm volunteering you, but I know you'll do this. and give you some feedback. And, because she's not a scorer, like she said, she's in a position that she's able to do that. So use her as a resource because she knows this stuff inside and out. I also wanted to reiterate to go ahead right now when you get off this call and make sure that your facility has paid their dues, because you're probably not the person that pays the dues. And sometimes that kind of waits until the last minute. And so that is on my list. That's the first thing that I do on this proposal, is to make sure that we're up to date on that, because sometimes that can take a little while for processing, for them to actually get the check. And you can't apply if you're not a member. But looking at the sheet that that Lisa has on the screen, as far as strong winning proposals, sometimes we win and sometimes we don't. But when we do, they have usually followed these 4 steps. Number one, they usually have really strong support. So the fit of the project is really, really important. And one way you can decide if a project is a good fit is by looking at, it's talking to your risk management team and your security team, and asking them, where do we have the most injuries right now? And what are our security concerns in the hospital? And then kind of looking at what the needs are and seeing where those two things merge. Our risk management teams keep amazing, workers' comp records and those types of things. And we want to mitigate that. We want to make sure that our employees are safe and not having injuries. So there's tons of things that you can do to help that. So we look at those statistics. We look at the support for implementation. It's great if you get a stretcher, but if nobody really has back injuries, then that you can't really prove that it's going to actually be helpful. So, find things that are provable that they're going to actually be a risk mitigator. And then once you have that, you want to go ahead and start getting those letters of support. Like Lisa said, you want the top dog to definitely be behind this, but you also want your employees to be behind it. And that really serves a dual purpose. Number one, it shows support for the project, but it also shows your employees that you care and that you're really trying to do things to help them, and they really like to get on board with that. So you can have multiple letters of support, but you need to go ahead and be collecting them. If you wait too late, then they're going to sit on somebody's desk and you're not going to have them back in time to turn them in. So go ahead and start working on those things now. Get a good fit for the project and then go ahead and start collecting that support. Also, you want to have smart budgeting. You want to think about, if you're buying a piece of equipment, then there's a cost for that. There's a quote that probably you already have for that somewhere in your hospital, but you want to think about the implementation of that equipment. And those costs can be things that your hospital will actually be putting forth on their own. And it shows a buy-in. It shows the grant writers that are the grant scorers that your hospital has thought this through and that you have some ownership in this project too. It's not just them purchasing a piece of equipment, but it's you also investing time to implement the equipment appropriately. So you have staff already that are going to use this equipment. How much are they being paid? How much are they going to be paid as they're being trained? those are things that you're already paying for because they're employed by you, but they are important to parcel out to show that you're setting aside that time for those employees to learn how to use the equipment that you're going to purchase. And you can include those in your budget. So personnel costs, installation costs, like there's a picture there of a piece of lift equipment that our ops team actually had to come and like be present when that was installed so that it was installed correctly and safely. And then our employees had to be trained on how to use it with the patients. And so that's, that's important time that everybody is using, and they're being paid for that, the staffing costs of that are on the hospital side that you can put forth to show your investment. Also, staff sentiment, you definitely want to show a lot of different perspectives. You want to show that the employees are concerned about their own safety and that this item that you're requesting is really going to help them. In the picture there, it shows a duress button that our employees are starting to wear all over our hospitals. Last year, one of our affiliate hospitals got funding for duress buttons through the HWCF grant. And our employees are really excited about this. It really gives them a feeling of safety. And you want to show that in not only in the text of the grant, but also through letters. And then the administration is concerned about it, that they really want this to help support their employees as well. And how that will manage risk, how that is going to show back up in number one, maybe a reduction in injuries or safety or whatever. And those can actually turn into goals. When you're going back and looking at the data and turning those into goals, they become measurable, that you want to reduce, the injury or the risk. And then last, you want to think about this is an investment. HWCF is fronting the $20,000 up to $20,000 for whatever it is that you're purchasing, but it's an investment in the future, and you want to see some type of long-term sustainable multiplied results from whatever that is. It's not just that we get a shiny new stretcher and that looks great. It's that this stretcher is actually going to last for many, many years, and it's going to have a multiplied effect, not just this year, but for lots of years to reduce risk and injury for staff. So think about that kind of bigger picture, the long term, how this actually affects even just your capital load. If we buy one stretcher with this grant, then it's going to be able to allow us to buy more stretchers like it in the future. So your purchase of one stretcher is this one thing, but over the course of time, it's actually going to afford us to be able to move capital on our capital expense list. So it might jumpstart plans, or it might strengthen plans. The train the trainer concept is a particularly good concept too. The picture here shows 1 year we got a train the trainer funding for a security program that all of our employees now have been through, because HWCF, the funding from that grant that year trained, I think, 30 people to learn this special security class called AVERT training. And then they came to each department in our entire system and trained all of the employees in all of the departments. So the multiplier effect of that was huge. And now, we're all trained on it and can continue that process over many, many, many years. And that was several years ago that they funded that, and we still have that implemented today. So when you can report on those kinds of statistics, that not only does it help in this instance, but in the future, it's going to continue to grow and multiply. It's really just about being creative, about thinking about the bigger picture of how this one ask can make a much longer impression. So really, this is a proposal that's a little bit different from most of the ones that I write, because Lisa is a fabulous resource that I don't find in any other proposal that I write. And really using her as a helper to get your goals and that sustainability piece is really, really important if you can't come up with measurable things. But also it's a good fit kind of grant. It's a specific grant that is going to scores that don't know you or your hospital, but they do know how important it is to merge together the risk to the employees and how to solve that risk. And that's really the biggest piece. So you're going to want a lot of data to support that. And if you follow those 4 steps, you've got a winning proposal. There are years that I kind of turn something in and I know it's weak in one of these areas, and those are usually the years that we don't get funded. But if it's strong in all 4 of those areas, it's going to work, you know. So you have to really make sure that that it's that way from the start, and that takes some thinking. It takes some thought. On those years that we don't meet all 4 criteria, it's usually because we just couldn't find the right project to fit, and that really you know, sometimes there's factors out of your control. You can't get everybody on the same page about it, but for the most part, if you can start early, you can. So those are my tips.
Thank you, Christy, so very much for sharing with our members. And if you all have any questions, like I said, please type it in the questions box. We're so very grateful, Christy, that you gave a little bit of your time this morning to share some of your insights, because like I said, I'm not an expert in grant writing by any means, but I'm very passionate about this grant process and this grant program. And so I just appreciate you. All right, let me just share with you one last little thing, and this is the application itself. Let me pull up my other one because this is, give me 1 second, y'all. There we go. Now let me flip over. My apologies. I've got a bunch of screens here, so I want to be sure I'm sharing the right one. Now let me change up. All righty. Share a different screen. And this is just the application itself, y'all. So here we go. All right, so this is just the application itself, and everything at the very beginning we've already pretty much covered. These are the important dates that I've got, and I will give you more confirmation on the dates in May as we move forward and we get our exact board date nailed down. But typically what happens is we will invite the winners to either join us virtually or in person for that board meeting. And that's when we'll make that announcement. So if you get that invitation, it's a good sign. All right. I'm not at liberty to tell you people they've won or they've not won, but I generally almost can't help myself to just say, please come. We're excited for you to come. So these first few pages of the actual grant itself was everything I just went over in that PowerPoint, basically word for word. That's why I'm just going to scroll through this. What the required criteria is, what the exclusions are, the process, and then we get into the grant. And we made it fillable. So we hope that everybody will be able to do this electronically and submit it back by email to me. But if for whatever reason you can't get it to work, contact me. I can't do it because I'm not IT savvy, but I do have an IT person that can help me provide it to you in a different format if needed. But worst case scenario, you print it out, you handwrite it, you scan it and send it to me. We will take them any way we can get them. But this first page is just about your organization, who your CEO or administrator is, and who's going to be that project coordinator that I can reach out to on a regular basis. Everything else is in here. If you have to mail the application, it's where to mail it, but preferably send it by email. It's got my email address at the very bottom. And then this is the letter that you can utilize from your CEO. Initially is just the signature page. But this does say, of course, that you will allow us to take pictures, share videos, things like that of your grant winnings with our other members so that they can see what potentially they could apply for. The next page starts talking about how much money you're requesting. So number one is the amount of grant request. How much money you want from us. Is that $20,000? And then you're going to pay $48,000 because the next one is the total project budget. How much is the total project going to cost? So if you ask $20,000 from us and it's a cost of $48,000 total, then in this number, probably going to see $48,000. And then down here, you may say self-pay, or it may come from a fund or whatever. Then that would be your $28,000. And it can be broken up into multiple different ways. Sometimes at our smaller facilities, auxiliary, or our, what some of us refer to as pink ladies or whatever you call them, they will raise money to help go toward equipment or needs. So that may be one of your lines. But I would encourage you to ask for the full $20,000 if your grant project is going to be more than $20,000. And keep in mind the cost of training your staff members. You may just have to do, get with HR and give a roundabout figure and just say, let's say every RN in our facility makes $25 an hour on average. How many RNs are there that are going to have to be trained? And put that into your funding, right? Our board wants to pay the full $20,000 to any applicant that is going to have to pay any money out of their pocket. They want us to pay it all. Okay, so don't try to take over some of the payment yourself just because you think it looks good, because our board would rather us pay for that if it's within that $20,000 limit. So here is your project description. And in parentheses, you see problem need statement. That's because on the scoring tool, it's called problem need statement. And that's where they're going to look at all this information and make sure that you applied into that what they're scoring. So I'm going to show you that in just a moment. The next one is your goals and objectives, and that's exactly what it's called on the scoring tool. The next one is project development and timeline. That is what it's called on the scoring tool. And the last one is expected outcomes. On the scoring tool, it's called project management. So make sure you look at project management as you start to fill in expected outcomes, because you know exactly how they're going to score you in that area. Your team or teams or departments that are going to be utilized to accomplish this project. Again, don't leave out maintenance, biomed, education, training. If you're going to utilize us to do anything, name us as part of it. Sometimes we have a class that's about back safety. Well, we do have a class about back safety, ergonomics, falls, things like that. So if your project is based on something like that, you can also implement us educating your staff on just the concept of utilizing and preventing these type injuries. And then additional information. We just left that open for you to free type anything you want. And above all, send us attachments. If you do research, if you have a quote for your project, a piece of equipment, whatever it may be, send that with an attachment, as an attachment with your application. Like I said, the better painted picture for our scores, the better score you're probably going to receive. And then we go to this last page, which is the actual budget itself. You don't have to fill this out as long as you make it very clear to me in the other part of the application how your money is going to be spent, but you're welcome to fill this out yourself. Most all of the money that we get for our projects goes to capital costs. And that means different things for different people. But this is where most of the equipment and things like that is going to fall into. If you're going to have personnel that's going to be trained for use of a new equipment, or they're going out of state for training or certification, that's the box you'd use for it. How much are we going to pay for, or how much is somebody else paying for? Just depending on how you're applying for our grant. Travel, if that's going to be needed, if you're sending staff away to do something. Consultants, if you're paying for, we had one year a facility who wanted to re-educate their staff on the lift system that they currently had in place. There had been so much turnover over the years, and they felt like staff were just not at the maximum education level they needed with the equipment. So they paid for a consult with the product manufacturer to come in and train their staff, and we paid for that. Supplies and advertising is generally not something we see a lot of put into the grant. Incentives, there may be some. Administrative costs, there may be some. And then anything else. So basically, it's just broken down here for the final time. The amount you're requesting from us, whether that's $20,000 or what, the amount that may come from somewhere else, could come from you. It could come from a manufacturer that's giving you a discount, value of in-kind support, and then anything other in total. So let me flip real quick now to the actual scoring tool. Here we go. This is the form, the only form that I fill out. And this is to say you're eligible or not eligible. I simply go down here and answer these questions. Are you a current member? Did you get your grant in by the timeliness that it was supposed to be? Do you have a specific workplace initiative targeted? The project has measurable results. The project is adaptable to others. You have a letter of support. Your detailed budget is included. You indicate willingness to share information with others. You have a project coordinator, and you're going to submit progress reports on these dates. Most always, this is yes. I have had to check no a couple times. Once because I received an application after the deadline and nobody had communicated with me that it was going to be coming late and why. And then twice I've had to deny an applicant because they were not currently financially current with HWCF at the time that they applied. And I tried to get them there, but they just couldn't. So the next page is that budget again. So if you don't fill it out, I fill it out and put it in here for you. But if you fill it out, I just take this page out and I put your page in. And then starts the scoring tool. This is where only the scorers document anything. So for your problem and need statement, which matches on your application, these are the 3 things they're looking for. Please keep in mind that these are weighted scores. 30% is the highest percent that we've assigned to any category. So your problem and need statement is very important. Goals and objectives are 15%. This is where, like I said, we see a lot of them kind of plummet. Our scores just don't give high scores for this unless you're very specific. Project development is 25%, and that covers a lot all the way down through this page. So be sure you're looking directly at the scoring tool as you're filling out your application. The project management is 20%, and then your budget is 10%. And then what I do is give them general comments. They can tell me anything about your application that they thought was good, what could be improved, if they thought it was a great idea that they're going to share. Because sometimes these are risk services in the other states, and they have very similar grants. And so they'll say, hey, this is a great idea they're implementing in Alabama. We need to look at this for our state. So they'll put that in there as well. And then if you are not a winner, I always reach out and say, would you like to schedule some time so that we can review your scores? That way you and I can sit down and we can go through every page from each of the scores and see how you did. And if you want to apply for the same project next year, you can. You know where your weaknesses were and where you can make improvements. We've had people apply for the same project for 4 years. In the 4th year, they won it because they just made tweaks every year until it finally got to those scores that they needed this, and that it was deserving of a win. I do not see any questions, so I'm assuming everybody kind of gets it. But y'all, you can reach out to me anytime. We've got till March 20th. So don't start late, start early, and reach out to me and get me involved early on if you'd like. If you get your application all the way put together in February or the beginning of March, and you say, I feel pretty good about it, but email it to me with an explanation and just say, hey, Lisa, I feel pretty good about this app, but would you just look over it and give me your feedback? I'm happy to do that. But if you don't request it, then I'm going to accept it as your final submission, and I'm going to have it ready to be scored, to find out if it's eligible and then send off for scoring. You have to ask me if you want my help, because otherwise I'm not going to touch anybody's application without their knowledge. I'm not going to change anything, not going to do anything. All right. Well, hey, thank y'all for your time. We got done a little bit early. I cannot wait to see what your projects are. I'm super excited because some of them are just absolutely amazing. And you all are so very intuitive about what you need. So thank you. Thank you again, Christy. We love you in Huntsville Hospital and we love all of our members. There's no favoritism to Huntsville just because Christy helped with this. Christy has applied some years, or Huntsville has applied some years, and they've not won. It's just kind of one of those teams like I compare it to football. It wasn't our season for Alabama this past year, but I'm still a big fan. I always will be. So sometimes it's our season and sometimes it's not, but don't let that discourage you. We generally have about 20 applications. If there are 5 winners, you got a pretty good stinking chance, right? So apply, please. All right. Thank you all. And please have a happy, safe new year. And I can't wait to start our webinar series with you all and get into the facilities again and start helping. Have a blessed year, everybody. Thank you. And thank you, Christy. Bye-bye.